Assalamualaikum and hello everyone. My name is Muhammad Arif bin Ahmad Jelaini. My metric number 9304230164950001, and for the subject clinical practice occupational safety and health management NBCP 2522, I'm gonna share about optimizing ergonomics strategies for a healthier and more productive workplace. So, what is an ergonomics? Ergonomics, we can define ergonomics as a discipline that focus on designing or arrange things to make sure it can help people to work in a comfortable and relaxed and in a efficient way. So ergonomics actually is all about preventing injuries and strain that can cause a long-term health problem. Many factors we can consider in ergonomics, such as the workstation design, the tool or equipment that we use during the works, how the work process, and our posture and the movement patterns during the works or the process. And next is the impact of poor ergonomics. Poor ergonomics is, you can say, the posture or the movements during the work process, which is, for the example, is awkward posture, or we can say uncomfortable positions for extended periods, such as bending, reaching, or twisting, and also repetitive motions or same movement in a multiple times, such as lifting and transferring patients, and also prolonged standing, usually in a healthcare worker, and also inadequate lighting. Poor lighting can cause eye strain, headache, and the impact is increasing risk of error and accidents. So, what happens if we ignore ergonomics during works? Or we can say we still in a poor ergonomics. It can lead to chronic pain, such as persistent back pain, which can decrease our productivity because the discomfort can make it hard to focus to do our job. And for a long period of poor ergonomics, it can cause us to feel mentally drained, can make us less motivated to do our work, and which it can lead to burnout. Then the next one is the key principle of ergonomics. So here we have 10 key of principles of ergonomics. Alright. So the first one, we must keep our joint in a natural position during works. Reduce excessive force and avoid bending forward. Always work in a proper height and try to alternate our posture and our movement during works, and avoid excessive motions. Also avoid carrying out tasks above our shoulder level. Limit the weight of a load that we lift. Avoid carrying load with one hand. And lastly is, if we need to use a tool or equipment or mechanical aids, then we must use them to prevent any injuries or strain during the work process. Alright, so this one is the strategies for optimizing workplace ergonomics. So if we do our job or our work using a chair, ensure your chair at a proper height and support your back or lower back, because it can help maintain a good posture and prevent back pain. And also for the desk setup, correct positioning of our keyboard and mouse can help reduce strain on our wrist and arm. For the monitor placement, keep the screen at the eye level and avoid glare, because it can help prevent the neck and eye strain. Alright, then try to take a regular breaks or necessary break, and during that time do some stretching, because it can reduce muscle fatigue and increase circulations. This way it can help prevent the repetitive strain injuries. Next one is the good posture, which is when we sit, make sure that our feet are flat on the ground and the knee is at 90 degrees, and our back are against the chair. By this way, it can help maintain a healthy posture. For the eyes, try to use the 20-20-20 rules, which is every 20 minutes take a 20-second break and look something 20 feet away, because this technique, it can reduce eye strain from looking at the screen. Also use the ergonomic chair or standing desk. Adjust the desk and monitor arms, and if we need to use, then use the anti-fatigue mat and footrest. So next is this is my workplace. So these two pictures showing that how I do dressing before I apply ergonomics, or a good ergonomics during my work process. So this young boy come to our clinic with a complaint of alleged motorbike skidded, where he have several abrasion wound on his right side of his body, and the wound mostly on his lower limb area. So as we can see, I need to knee for dressing his wound at the ankle area, and then for the wound at the knee, I am standing up in an awkward posture, or not in a good posture, which is by this way it caused me to feel the back pain, and also my foot is not in a comfortable positions. So after I apply a good ergonomics, as we can see, to do the dressing, I sit on a chair where my knee is at the 90-degree angle and my foot is flat on the ground. And for the patient, I put stool on his right leg so that I can reach his wound easily, and also the wound is at a proper height. By this way, it can help me to prevent injuries or strain from happen, and also for a long period it can maintain my health and prevent repetitive or persistent back pain. Okay, so this is my reference. I collect 3 reference from the National Center of Biotechnology, and also from safety culture, and then the med trainer. And then, so that is the last slide for my sharing. So thank you for listening. Thank you for take your time, look at my sharing. Thank you, and thank you everyone, and have a good day. That is all from me. Thank you again.